hit the record button now. And we can go ahead and get started. So good afternoon, everyone. Welcome. My name is Deb Poland. I know many of you, but not all of you. And I am the Executive Director of the Connecticut Association for Community Action. I'm really excited about today's session because there is a lot of concern and confusion around getting the COVID vaccines. Some of it is just confusion around how to register, who's eligible, what the appropriate processes are for registering for the vaccine. There are some people who are concerned about the efficacy, about side effects and so forth. And we know that you interact with so many people on a daily basis, and you are considered trusted messengers. And because of that, you have a unique role that you could play in helping to dispel some myths and help clarify issues for people in the community around the new vaccines. So we have some partners with us today from the State Department of Public Health and some folks that they have brought on board. Before we get started though, I just want to make sure everybody is engaged in the session. So I just ran out for a cup of coffee and I noticed how raw and rainy it is out today. And I'm wondering what your favorite kind of weather is. And if you can either shout it out or you can just write it in the chat box. But what kind of weather do you actually like?
Summer.
Summer. I'm a fan of summer too.
September in New England.
September in New England, yes. Fall.
Summer.
Summer. How about winter? Does anyone like winter?
No. I love winter, but neither winter, September, nor summer are weather. Just to say, I like sunny and breezy.
That's fair.
And 70 degrees. And let's stay right there.
Who put 75 and low humidity? I'm on board for that for sure. Does anyone like 45 and raining? Because that's what we have right now. Really, Kathleen? I'm feeling so happy about that because it means that there's somebody out there who's appreciating the weather that we have today. And you're the one. But we need the rain, right? We need it to make sure that we have beautiful flowers coming up and blooming on our trees in April. All right, so now that I know you're all awake from lunch and ready, snowy and 34 degrees. No, thank you. It's good though. It's good. It's good to have positivity about that, since that we do get that so many days in the wintertime. I'm going to turn it over to Megan Palmer, and she is going to kick off our session. I think, Megan, we decided that if people have questions, they can just kind of raise their hands and jump in at any point, or you can also use the chat box if you feel comfortable with that, and feel free to use the reactions. We just want to make sure this is as interactive as it can be so that you leave this session today with the information that you need to make sure that you're able to talk to people that you interact with at the community action agencies around the COVID vaccine. So wonderful. I'm going to turn it over to Megan.
Thank you so much, Deb.
Sure.
Sabrina, I think we can go ahead and pull up the slide deck. And as we do that, I want to just reiterate the excitement that we have to be here today with all of you and say a huge thank you to Deb for helping us organize this session. We are very excited to be sharing these materials with you. And as Deb said, really do see community action agencies and your leadership in particular as being really important as we think about enabling access to the COVID-19 vaccine across Connecticut, particularly for more vulnerable populations. And so thanks for making time today to listen to this information. We're really looking forward to the dialogue that we can have. So Sabrina, if you want to click forward one slide. Thanks. So I think just to sort of share a little bit on what today's purpose will be before we go into intros, we have been holding NOOP. Sabrina and myself are part of a small team with an organization called Partners in Health. That's a Boston-based NGO that has historically worked largely outside of the US as well as in Navajo Nation, but during COVID has taken up efforts in a number of different states and counties and cities across the US in supporting local governments and local health departments in particular in their COVID response. So here in Connecticut, we have been supporting the Department of Public Health community outreach effort within the vaccines group. And so have put together this Trusted Messenger Forum program in coordination with Carter Johnson. Unfortunately, our colleague is not able to be here today because she's unwell. But these Trusted Messenger Forums are meant to reach a broad variety of leaders and stakeholders. We've held sessions in the past few weeks with faith leaders, with senior center leaders, with coming up, community childcare providers associated with the SEIU, and are planning a number of different other events to come. And so, again, I think the role of these programs is to provide these sessions is to provide information on the vaccine rollout, on the science behind the vaccine. Noop, who's a physician, will be here to answer questions. And then we'll talk and have real dialogue on what you're observing and, certainly your creative ideas about, what you'd like to see and perhaps what role community action agencies themselves can play. And so let's just go around and do some quick intros. I'm Megan, as I mentioned, and I've been working on the Connecticut work with Partners in Health for the last 3 months, and am just very excited to be here with you. Noop, do you want to go next?
Everyone, really a pleasure to be here with you. I'm Dr. Noop Mehta. I'm an internal medicine physician, have been somewhat on the front lines of COVID-19 and taking care of patients in the hospital, but also working, as Megan said, with Partners in Health and Connecticut DPH on this project. And so you're just really happy to be here to talk about the vaccine and equip you with the facts you need to help the folks you're working with. So thanks so much for having us.
It's Sabrina.
Thank you. Hello, everyone. My name is Sabrina Charles. I am a public health practitioner, and I serve as a project manager supporting Partners in Health, as well as the DPH in disseminating the COVID-19 vaccine in an equitable way. So we're very excited to be here and speak with you all today.
Awesome. I think we can go to the next slide, Sabrina. And so, just to reiterate, this is really meant to be a dialogue. I think we're a small enough group that we welcome questions. We'd really like you to engage. We will have time at the end as well to have a more open conversation. This first portion, as the agenda on the right-hand outlines, is a little bit more information focused. So starting on your role and sort of suggestions and ideas about ways we've seen community partners being involved as trusted messengers, really leaders in enabling access for populations in the vaccine rollout. We'll provide information on the rollout in Connecticut. We will share information on the science of the vaccine. We'll share recommendations on key messages and sort of the nuts and bolts of how scheduling works, such that you can be knowledgeable about those sets of information to the extent that they are less familiar. And then finally, we'll wrap with dialogue. But please just feel free to drop questions in the chat. We are happy to have a much more interactive conversation, and hope that you will feel free to do so. So I think the last thing I'll say, before talking through your role is just, as Sabrina said, really the heart of this work is thinking through equity. And Sabrina, I guess we can advance to slide 5. The vaccine rollout to date, and Sabrina will walk us through this information in more detail. Connecticut, among states, has been doing, comparatively well in terms of the speed of the rollout, the number of doses given out to populations across the state. And certainly, I think, we've seen really tremendous leadership by community organizations, by professional groups, by local health, by providers. With that said, I think there really are challenges in thinking about the equity of this rollout, and some early data that we'll be able to share with you on how that looks. In tandem, we know that, while this first phase has been really, and we'll talk about this a number of times today, if anything, there's been a shortage of supply and an excess in demand for the vaccine, more so than, all of the individual vaccine sites that we have in Connecticut can support. At some point, this is going to also shift and really, be both about how do we help people for whom getting to clinics is a real challenge for one reason or another in terms of accessibility, And how do we help provide people with information among those who might have more questions on the vaccine safety and efficacy in a way that they can make an informed choice. And so, we're hoping with all of you today, we can talk about those issues, and that is really the spirit of why we are having these programs to begin with. So I think I won't belabor this point, but just to sort of affirm that as, community leaders, and I think in particular, community action agencies, I can't think of a set of organizations in Connecticut, candidly, that, touch, so many individuals in unique, really high touch ways, and really know their communities well. And so, you along with, other community leaders are really uniquely positioned to both understand the needs of the individuals that you serve, to be their advocates, to share information with them, and, to work with entities across the state, be it the Department of Public Health, local health, providers who are running these vaccine sites, to make this better. And so, you are absolutely central to this effort, and we want to empower you with information such that you can view yourselves, truly as trusted messengers. The state has been, for its part, as I mentioned, really thinking about both what's the policy, sort of the set of supply conditions that need to be in place, and in particular, how do we really think about the both operational and policy considerations that need to be undertaken to really make this rollout more equitable. And then on the right-hand side, obviously the role of vaccinators, whether they are local health departments in many cases, or individual provider organizations like Yale New Haven or CHC Inc., they are the ones that are actually making this happen on a day-to-day basis and helping people get the vaccines that they need. So we can move to slide 6, Sabrina. This is just a selection of different ways as community leaders that there's potential to help people. And I think there's not a one size fits all. This is a laundry list, but it's not complete. And so we'll want to spend some time thinking about what your own ideas are. And, Deb in particular has talked about some of the really powerful work that happened around census outreach, and just the potential to reach people that you all have led. So I think we can have hopefully a great discussion at the end about some of those ideas. But briefly, some of the things that we've seen community organizations drive and lead, both in Connecticut and elsewhere, encompass 3 different main groups of issues. So the first, just sharing information and resources. That can be in myriad ways, whether it's posting on social media, thinking about existing communication channels, maybe tax preparation meetings that you might have with individuals, as an example, to distribute a flyer, hosting a virtual town hall to answer questions on Facebook Live. Secondly, community organizations have helped play a real role in increasing access to the vaccine within their communities and really doing the hard work of helping people make appointments and ultimately get to them. And so this can look like a lot of different things. It could be calling on behalf of individuals and scheduling for them. It could be coordinating transportation. It could be advocating and really making plans for a specific clinic to support a dedicated group. For example, in past weeks, we've worked with the American School for the Deaf in planning one, hopefully in the coming weeks, for individuals who are deaf or hard of hearing. And then finally, I think, as is the case today, in every way that you lead, it's important that, and you can play a unique role in speaking up for the needs of your community. And so we hope in this session to learn from you about what you're seeing, and we hope to bring that back and elevate it to the right individuals within the department. And then certainly we see you as being individuals that can help us identify ways that we can drive this moving forward. Does anyone have any questions on sort of the outset of your role, thoughts or reactions to what we're trying to share in terms of information today? We're going to dive into the information now on the rollout, and I'd welcome any initial reactions, thoughts, or things we could address.
I think it would be helpful for us to know going in, have you had questions already about the vaccine, how to get it, and whether people should get it? So I guess just pop something into the chat if you have, or just, oh,
I would be curious. How much engagement have you seen from people that receive
and
services?
this could include your staff. And I know many of you have childcare staff who have already been vaccinated. Many. Thank you,
Hi,
Tim.
Deb, this is Zelka.
Hi, Zalka.
We had I think it was 2 weeks ago, we signed all our staff. We asked our staff, how do they want to get vaccinated? We signed up people up for the vaccine. I think about, I can tell without childcare, the other supportive services, energy, we have about 50% of staff already receiving first vaccine. So the next one is scheduled in first week of April. So
Great.
we are kind of moving in that direction. And I know that early learning staff that's going through as a childcare providers, they're also being vaccinated. But I think it's about 60–70% of childcare staff is being vaccinated. And also we've been partnering with the Yale Health Department, and they're coming on every Monday, I think Monday and Wednesday, and they're sitting in our lobby and signing everybody else that want to get vaccinated, including our clients that coming through the door and parents. So we are definitely trying to help and promote the vaccine, COVID-19 vaccine.
Great. Thank you. Thanks for that. And I'm seeing in the chat box, a lot of people have had questions about when people are eligible, what are the phases, how do you get on a list, etc. So great. Hopefully we'll get answers to a lot of that today.
And I think what, was also expressed in terms of their, maybe the sort of concentration of the problem so far, feeling like it's around people wanting the vaccine, but needing additional support in getting it.
Mhm.
That is very common in our conversations. And I think it probably will remain the case in the coming, probably several weeks at least, while supply is still relatively constrained and more individual waves of people become eligible. But, I think it's also a wise point. I believe it was from Marlo that may not be, the problem in months to come at some point, once everyone's eligible and a little bit more time has passed with the supply to increase. So I think we'll definitely look to come back to these issues. Thanks so much, everyone. Sabrina, do you want to take it from here?
Sure, thank you. I can sort of go into presenting on the status of the rollout and then provide more information on the vaccine, generally speaking. So currently Connecticut is now vaccinating individuals 55 and older and is soon expanding eligibility. So we are in phase 1B, where the focus is on healthcare personnel, long-term care facility residents, as well as medical first responders. And now there's a focus on individuals 55 and older, in addition to pre-K to 12 school staff and teachers, as well as professional childcare providers. So the governor has announced that future eligibility expansion waves will be done by age. In addition, from March 22nd, starting March 22nd, individuals within the age range of 45 to 54 will become eligible. And excuse me, that has been adjusted to March 19th. And in April and May, based on those dates, we will begin to have that more eligible for younger individuals. And as of Sunday night, 1.4 million doses of the vaccine have been administered, including 900,000 of the first doses, where 40% of individuals between 55 and 64 have received at least one dose of the vaccine. So Connecticut will open up vaccine scheduling to the final two age groups, 35 to 44 and 16 to 34, and they'll be combined into one group, with scheduling anticipated to start for 16 and up group on April 5th. And then, go ahead.
I was just going to add, I think you might have been about to say this, Sabrina, but one thing that I think has been at times, a source of confusion, and certainly, a real challenge that we want to make sure is clear, is that as individuals become eligible based on their age, based on their profession, Connecticut, and is in the case in the United States generally, wants to make it clear that all individuals who are eligible are welcome to be vaccinated, as it says along the top. And that means even if someone does not have insurance, even if someone does not have documentation, a driver's license, even if someone is, basically, living in a state where they might otherwise feel vulnerable. It's been, I think, particularly a concern among the undocumented in Connecticut about whether and how they can get the vaccine. But the message we want to relay to all of you is that everyone is eligible, everyone is welcome, and we're happy to talk through questions on issues that people might have seen.
Yeah, and we definitely want to stress that message across our messaging throughout the state, that all that are eligible are welcome to be vaccinated, no matter the insurance or immigration status. So as I mentioned, more than 1.4 million doses have been given in Connecticut to date. There are a growing number of places where people can get the vaccine, including mass vaccination sites, hospitals, as well as federally qualified health centers, and local health departments, pharmacies, and mobile clinics. And then we're hoping that medical groups and doctors' offices will be able to also administer that. And I'll go into a little bit more detail about where specifically individuals can get those vaccines in a little bit. And then we do expect the vaccine supply to increase within the weeks to come. Projected, we've been seeing about 200,000 doses administered weekly. And there have been significant challenges in the vaccine rollout, but Connecticut is making some significant progress, where 17% of people living in the state have received their first dose, and more than 8% are fully vaccinated. So 75% of covered individuals, 75 and older, have been vaccinated, and there are a growing number of places where people can get that vaccine.
Sabrina?
Yes.
We have a question in the chat box, and it says that two different things: all who are eligible versus all are eligible. Can you just?
That might have just been my idiosyncratic speech. Apologies. Basically, the governor has announced eligibility based on age primarily, as well as in specific cases like for teachers, individuals who are working actively in schools, or childcare providers, professional groups. So eligibility is based on those determinations at this point. And by early April, everyone 16 and older in Connecticut who lives or works in the state will be eligible. So within that, once you have eligibility, no matter your insurance, no matter your documentation status, you can get the vaccine.
Great.
Yeah, and I think the eligibility on top of eligibility might have gotten a little confusing.
Yes.
Thank you.
Good question.
So I just wanted to share a little bit of details about the data in Connecticut in terms of individuals that have been vaccinated, and there has been a bit of a racial and ethnic disparity among those who have received their first dose. So across the state, we do see a bit of a disparity in people of color. It looks like the white and American Indian population have been able to receive their vaccine, and this has been broken down across the age range, where we do see a bit of a lower percentage in Asian, Black, and Hispanic populations. So we definitely want to be able to make sure that the vaccine is available and that it is distributed equitably. So through this, we really want to just make sure that we, for many reasons, see this disparity and we're able to address those various reasons. See a question in the chat.
Talisa, I think this is a really important question. I think we should get it into it further as we continue the dialogue at the end. But I think one quick response that I would offer, is I think there are a number of different strategies. Noop will talk us about like meeting people where they are and issues being really different from individual to individual. And certainly there might be shared concerns within groups. I think we've all read articles in the media, but in no way is this restricted to communities of color. And so I think it will be important to think about, what is the specific driver of someone's hesitancy or concern about receiving the vaccine or challenges. And I think that there are a number of different strategies, and I'm sure you all will also have ideas, but let's bring that back up at the end.
Thank you. So the Department of Public Health is working with providers and local health to improve the equity of rollout and a twofold type of approach. The first one being giving people the information to decide that the benefits of taking the vaccine outweigh the risks, as well as addressing challenges involved in finding and receiving the vaccine. So more on the side of looking at the benefits of taking the vaccine, definitely deploying community outreach specialists, as well as launching these trusted messenger forums to really equip our community leaders to share that information within their communities, especially doing that outreach in communities of color, and then supporting multilingual education and social media campaigns to really boost the vaccine confidence. There may be individuals that don't speak English that we want to be able to still provide that information to them. And we've even, like Megan mentioned in the past, been able to support individuals who are deaf or hard of hearing. So really just making sure that that information is available and then also just deploying it in an understandable way. And then on the second half, really addressing challenges in finding and receiving that vaccine. So really, the efforts have been focused on 75% of weekly supply to towns and cities with the highest proportion of underserved populations, and then setting targets and associated strategies in coordination with vaccine providers to really ensure that those vaccines are administered to people living in the highest risk communities. And then there are also pharmacy clinics that are within underserved rural areas that are really making that push to get the vaccine available. So the goal for the COVID-19 vaccine is to reach Was I muted for that last portion of the slide? Okay, so what was the last piece that you guys heard?
The goal for the COVID-19 vaccine is?
Okay, all right. And I believe I will be passing on to Noop here.
Hi, everyone. I have the distinct pleasure of getting to talk about the vaccine and the science behind the vaccine, and hopefully to answer any questions you might have about the vaccine. Actually, I should say vaccines. So now there are 3, plural, different types of vaccines that we can give to folks. So ultimately, this slide says the goal of the COVID-19 vaccine is to reach community immunity. I mean, really, the goal of the vaccine is to stop the pandemic, right? I mean, that's ultimately what we're trying to do. But the way to stop the pandemic from continuing is to try to achieve this idea of community immunity, or what some people call herd immunity. I don't really love the term herd immunity because it sort of sounds like we're cattle or cows or something, but we're not, we're people. So let's try to, I'm trying to get everybody to start saying community immunity. And it's nice because it rhymes. But the idea there is if we can vaccinate enough people or create enough immunity amongst the population, then the vaccine can't spread anymore. And so the analogy, and you're welcome to use this if you like it, that I like to use is sort of like, remember when we used to be able to go to ball games or like sporting events and like everybody would do the wave? And so then the wave would sort of go around and around the arena because everybody was participating in the wave. But now let's say like only a handful of people decide they want to stop the wave. Well, what happens? Like it still goes, right? It still keeps going around. It might slow down a little bit, but it will still keep going until enough people decide they want to stop doing the wave and they sit down. And then what happens? Slowly, the wave dies out and it stops, right? And so that's the same thing that happens with vaccinations, as that as more people achieve immunity, the spread of the virus goes down. Now, we are talking about something upwards of 70% of the population. Now that's a big number, right? We don't get anywhere near that for, say, yearly flu vaccines, but we do need to try to get to that point. But even if we don't hit 70%, as we get closer and closer to it, the spread of the virus still goes down. So even if we don't hit that magic number, at least as we vaccinate more people, as we get more people to have immunity, the virus will be spreading less and less and less and less. So, but it's tricky, right, to get to that number because as sort of Megan and Sabrina sort of mentioned, supply has been a big issue. There's been way more demand for the vaccine than there has been available vaccine. But the good news there is that we expect that to really flip. And that's going to happen pretty soon here, if not already in some places, where there's going to be more supply of the vaccine than there are people to take it. The other thing that's sort of going against our ability to slow this virus down are these new variants. Now, the good news there is that these variants are susceptible to the vaccine, meaning that the vaccine works on these new variants. The only challenge is that the vaccine can still spread fast amongst people who are unvaccinated. So just raises the urgency to get to the vaccine out to as many people as we can. And then finally, of course, as everyone's sort of been mentioning, is some apprehension or lack of confidence in the vaccine due to a lot of different factors. But that is going to be a challenge in getting to this magic number of 70%. So I'm going to talk about sort of why there's been challenges with vaccine confidence. And it really has to do with these three factors on the right-hand side. There's been structural complications with the healthcare system. And Frank, look, I'm not gonna like pretend that there aren't some people who have been treated very badly by our healthcare system. Systemic racism exists in our society. It also exists in healthcare. And so those structural barriers persist, and people just frankly don't trust the government to do the right thing for them. It's been hard to find good information because people are on social media. People are also sort of surfing the web, and you hear conflicting things. And so finding good places to get the right information is tough. And so that's part of why we're here today, right? Is to give you all, as trusted messengers, the right information, or the information that you need, not to necessarily convince someone to get the vaccine, but at least to give them the information they need so they can at least make an informed decision one way or the other. And then finally, we know that lots of people have lack of access to the vaccine due to a lot of factors, right? If you can't get into a car, or you don't have a car, you don't have access to a car, you can't very well go to Rensselaer Field and get a vaccine, right? And so some of these challenges, I think somebody also mentioned, people who are homebound. That's a great point, right? If you're homebound, you can't get to a vaccination site, well, then you have this logistical barrier to getting the vaccine. And, of course, these factors affect certain communities more than they affect others, right? People who are lower income, right? Like I said, they don't have a car, they have access to transportation, they might not have internet, maybe you don't speak English and you can't sort of navigate the healthcare system. Maybe you're older, maybe you're frail, and like I said, you can't leave the home. Maybe you live in a rural community and it's just too far away to get to one of the vaccination sites. So for all those reasons, we know that certain populations are going to have more challenges accessing the vaccine than others. And so that's our job, right? Is to try to overcome some of those barriers. Renisha, I'm going to answer your question in just a second. Stay tuned. So, you know, we know that there are people all along this spectrum, right? There are some people on the left-hand side who are going to get the vaccine. They're excited to get the vaccine. They have all the information that they need, and they're just, you know, they're waiting in line. They want to get it as soon as they can. And we also know that there's some people on the right-hand side who are really skeptical, right? They don't trust the vaccine. They don't believe that it's a problem. Hey, they might not even believe that COVID-19 is a real illness. And then, of course, there's everybody in between. Now, we're not likely necessarily in our conversations to move people directly from the red zone to the green zone, right? But maybe if we engage people in the right way and talk about this vaccine or these vaccines in the right way, we might be able to move them up a level, right? We might get them to go from, you know, red to orange or orange to yellow or yellow to green. And that's great because sometimes it might take more than one conversation in order to really change the hearts and minds of people and get them to sort of activate themselves to go ahead and get the vaccine. And look, we know that the message and the messengers and how we deliver the message is super important. As sort of Megan was alluding to, you know, each conversation is unique and each person's reasons for why they might be hesitant to get the vaccine are different. And so there isn't sort of one size fits all way to have these conversations because you'd have to vary it based on these factors, like the messenger, you know, who's delivering it, what you're saying, and what the, you know, sort of concerns are of that individual.
I think one point just to get at, you know, to Lisa's question, perhaps one thing that has probably been, you know, pretty much universally shared in any work we've done or any conversations we've had is it is really important when you think about whomever might be asking for information on the vaccine, thinking about who's the right trusted messenger to reach them, or set up trusted messengers. And so it is really important for people to talk to people who they trust. And in some cases, if it's not a direct pre-existing relationship, they might be more predisposed to trust someone who comes directly from their community, who looks like them, who speaks their language directly. And so all that to say, like, as you think about access for the various, you know, many individuals who might need information on the vaccine or might have more or less vaccine confidence, it is important to think about who's the messenger and how are you reaching people and not trying to reach them in a way that, you know, feels like very distant and irrelevant to their day-to-day.
That's great. Okay, so I wanted to just give you 6 big facts about the vaccine. And look, we know that myths are out there, right? There are myths are circulating about these vaccines. And I want to be able to today to at least dispel some of those myths and give you the information that you need perhaps to have, you know, a thoughtful conversation with someone you might be trying to work with. So I'm going to answer Renisha's question first because I think it's a really good one, which is what are these vaccines, right? What are they all about? So these vaccines, first and foremost, are like any vaccine you've ever taken, right? If you've ever gotten a tetanus shot or a measles vaccine or a mumps vaccine, any vaccine that you will ever take, the purpose of the vaccine is to do the same thing, which is to give you protection from that disease. So these vaccines, the main purpose of these is to provide protection against COVID-19 and also to help protect yourself as well as your loved ones. And so, you know, in very simple terms, that's what these vaccines do. Now, you might be asking a different question, which is, how do these vaccines work? And these vaccines are really an amazing bit of technology. And I think what is not often understood about these vaccines is that this technology was specifically created, and it's been around for a decade or more. So just so you know, it's not like it was invented last year. This technology has been around specifically for this situation. These technologies, the mRNA technology, as well as the viral vector technologies, were created just in case we were ever in a situation where we had to make a lot of vaccine and get it into a population as fast as possible. So in many ways, they're doing exactly what they were invented to do, which is be able to generate vaccine and therefore immunity quickly. Normal vaccines, the ones you take at your doctor's office or the flu vaccine, they take over a year to make, whereas these can be made really, really quickly. So that's what their purpose was in the first place. One last statement, which is the mRNA vaccines, the way that they work is that they tell your body with a blueprint to make just one little part of the virus. It's a totally benign part of the virus, and certainly not the whole virus itself, so that if the body ever sees the real virus, like the full part of the virus, then it will be able to attack it. So think about it like, it's like the hand. It's just the hand of the virus, so that if it ever sees the hand again, even if it's connected to the rest of the body, it will make sure to attack that virus. And the same thing is true for the Johnson & Johnson vaccine. It's a blueprint. It tells your body how to make that one little part of the virus so that when it sees that again, it will be able to attack it and destroy it. Okay, that's a good question. No, we're not done yet. Stay here for a second. So I'll answer Ian's question in a second. Fact number 2. First of all, I just want to make sure to be very clear. Fact number 1, these vaccines cannot, it's impossible to, they're not made that way. They have no actual live virus in them. There are some vaccines where you take them and it has actually like sort of deadened virus, but they're sort of live. This is not the case for these. They don't have any live virus, and they cannot give you the virus in any form or fashion, nor can they actually change your DNA, which is in fact number 4. Ian was asking about fact number 2, which is why were all these other vaccines tested over a longer period? And so this is really important to understand. So these vaccines were tested over a very, very short period, not because any corners were cut, but because they poured a ton of money into enrolling people, getting the data systems, the logistics and operational deployment of the trials into doing them at lightning speed. In fact, the prior administration called this Operation Warp Speed because they're trying to do the normal scientific process in a compressed time frame. So I think it's very important to understand that the FDA didn't approve these vaccines under emergency use just because they wanted to get something out there. No corners were cut, and the same thresholds that they would have used for any other vaccine were followed to approve these vaccines as any other normal vaccine. Megan, you want to add something?
I was just going to say, I mean, I think just to add, support to what Noop's saying, mRNA technology, as he mentioned, it is based on the way it works, such that with a viral sequence, you're able to sort of create products to test very quickly. And as Noop mentioned, with mRNA, and Sabrina's bringing up a slide that kind of just shows the end-to-end development process. We'll share these materials with you after. But, mRNA vaccines have been in use. Obviously, relatively, or none of them had been approved formally by the FDA prior to this point. But I always share, my dad had melanoma that had metastasized to his brain, and he received an mRNA vaccine in clinical trials, or several mRNA vaccines in clinical trials over 3 years ago. So I think there are other ways these vaccines have been used. They are not brand new to the world.
Yeah, that's great. Let's go back to the 6 things. I'm almost done because I want to get to numbers 4, 5, and 6. Okay, as I mentioned, fact number 4 here is that they cannot actually alter your DNA. So far, and you look, there's some things we don't know. I'll be honest with you, because we just haven't been using these for that long. But one thing we know almost with 100% certainty is that these vaccines have no ability to alter your DNA. We know that because we first of all, our body makes mRNA all day long, and there's thousands and thousands of copies of mRNA that are being made by your own cells and destroyed every single day. And the mRNA that's being provided as part of the mRNA vaccines is the exact same as that. So they're being turned over, and they don't have the ability to last in the body beyond a couple of days. So fact number 5, and this is what Marlo is bringing up in the chat. It's very interesting. I'm sort of disappointed to hear that doctors are saying that. The fact is, there is nothing to link these vaccines with any problems with women's health or their ability to stay pregnant or fall pregnant. It's just not been proven, not been shown, and I think everything that we've seen about people who are pregnant or who want to get pregnant is that there's no impact on their ability to carry to term. And in fact, I would argue that unfortunately, pregnant women are actually more susceptible to COVID-19, and so they should actually be prioritized in getting the vaccine, because we know that when women are pregnant, they are actually more susceptible to illnesses. I don't know if you guys remember the H1N1 pandemic, which was now over a decade ago, where pregnant women were the most likely to suffer consequences from developing that flu strain. And then finally, just fact number 6 is to just say that we know what's in these vaccines. I think it's really important that the ingredient list for these vaccines has been published. It's very well known what's in them. And interestingly, it's super simple. And it's actually far simpler a vaccine than most other vaccines because there's very little preservatives. So you may have heard that they have to be kept in very cold storage. Well, the reason why they have to be kept in cold storage is actually because they're so simple and they don't contain any preservatives. So that's why they have to be kept in such cold storage, is to try to prevent them from having anything that's unusual. And these vaccines are basically made of water. There's some salt in there, there's some sugars in there. And then there's the 2 components. There's the genetic material, which is in this case mRNA, or in the Johnson & Johnson vaccine, DNA. And then there's the transporter that gets the DNA into the cell. And the mRNA, it's basically like a capsule. And in the case of the Johnson & Johnson, it's like a dead virus that's like sent into to deliver the mRNA. Interesting for Mary, there's no pork products. Again, it's not involved with animals at all. It's all created in a laboratory in like sterile factories with no pork. And then I think someone asked a question about how long does the immunity last? Great question. That's one of the things we don't quite know for sure. The good news is that so far, after about 9 months of us being able to look at the vaccine and see these vaccines and see their effects, is that we've seen pretty prolonged immunity. So far, there hasn't been a big drop off even after 9 months. It's not to say that we won't need a booster. I think there's probably a good chance that we will need a booster, just because most vaccines require some sort of booster over time. And so, yeah, my suspicion is that we will need a booster. I mean, this is just my opinion. I think that it's still a little bit unknown as to when or how, when you're going to need it. Is it going to be 1 year, 2 years, 5 years, 10 years, 20 years? We just don't know yet. So let me pause there. Any other questions that I can answer? I'm happy to take them in the chat, or also, if you want to come off mute and ask your question, that would be fine too.
I just did some quick Googling. So to address Mary's question about the pork products, there are apparently some vaccines that use gelatin from cows or pigs to help stabilize the vaccines. And that would raise that issue that you mentioned for some Muslim and Jewish people. However, these particular vaccines, the Pfizer and Moderna, have released their ingredients, and they do not use gelatin from they don't use pork gelatin in their formula. Johnson & Johnson has not released their ingredients, apparently.
I think we have a high level list as well from the FDA on J&J, and you'll have that in these materials when you receive them. And some of the names will be very intuitive, like sugar, some of them like polysorbate 80, not so intuitive. But Deb, thank you for that clarification. And I think it's, it's a good question. And as Noop said, one important thing that's come out with these vaccines is there are very few additives, preservatives that could raise these issues, both in terms of objections for different reasons, or even just pure allergies being a concern.
Yeah, there's been one very important thing about, if you've been allergic to a prior vaccine of some kind, maybe the flu vaccine, whether you can still get this COVID-19 vaccine. And again, so far, the allergic responses has been pretty minimal. All vaccine sites are required to carry epinephrine as well as antihistamines in case you do have a allergic response, again, which is pretty uncommon. And again, that's partly why they ask you to sit around for 15 minutes after the vaccine is administered, just to make absolutely sure that there isn't any type of anaphylactic type response. But again, those have been pretty uncommon. Now, there are some side effects, so that has been pretty well reported. All three of these vaccines have side effects. Interestingly, the J&J vaccine has less side effects compared to the other two vaccines in terms of sort of systemic symptoms of like low-grade temperature or sort of aches and pains and malaise. But for the vast majority of people, within 48 hours, those side effects go away. Actually, almost all. And just for what it's worth, both Megan and I have gotten the vaccine. I don't know if you have, Sabrina, but hey, I had no side effects personally. I think I had a sore arm for like a day, and then it was gone.
Sore arms for me as well.
Yeah.
Plenty of people I know have been tired or had a low-grade fever for an hour or several. Like Noob said, all in those timelines very short, but ours were minimal.
Well, great. Well, thank you all. I hope this was helpful to help you sort of gain a little bit more understanding about the vaccine, or if not, at least reinforce some of the things you already knew. And as we continue today, just if you have a question pops in your head about the vaccines itself, please feel free to pop in the chat. I'll be here for the whole time. So thanks so much.
Thanks so much, Noop. So Sabrina and I in these last two portions are going to take you through a bit more information, starting with messaging on the vaccine. And then Sabrina's going to talk us through what the various options are for scheduling. We're going to be pretty brief so that we can have a good chunk of time for discussion, but just know questions are welcome. So Sabrina, if you could just advance. Awesome. So in terms of messaging, meaning like how we talk to people about the vaccine, as we talked about, every person is different. Everyone is going to have different questions, a different life history, life experience that's sort of bringing them to raise the things that they are. But there are some core elements to how we talk about the vaccine that are generally helpful. And these have been both, I think, sort of consistently viewed as helpful ways to talk about vaccines from a public health perspective generally, as well as, particularly helpful in this moment with COVID-19. And so in terms of the general principles to think about when communicating with the vaccine, one point to sort of emphasize, and this is hopefully fairly intuitive, is just leading with the positive. We want to emphasize the big idea of why we're here and why we're talking about this, which is the importance of receiving this vaccine to protect an individual, their loved ones, people who they are close to in their communities who are vulnerable, and ultimately, bringing this pandemic to an end. I think it's something that's been interesting in reflection in this work is to realize how many times when we talk about the vaccine, we start with the negative, or we start with the question, or we start with the myth. And from a communication standpoint, that can actually be quite detrimental. And so, just to sort of think about leading with the positive, leading with the big idea. We state the facts. So before, again, kind of connected with the previous point, rather than echoing a myth or, a sort of concern, really starting our communication by affirming what is a known fact about the vaccine to ensure that that remains in focus, even as in subsequent words, you might acknowledge the existence of some doubts or some concerns. Third, it's important to mix positive stories about really the experience of receiving this vaccine with our scientific information that we're equipped with. So it's especially in something like a town hall that organizations are putting together for individuals to listen to on Facebook. If all we did was review what the emergency authorization approval process was with the FDA, and we didn't talk about just, how there's a clinic that had been set up in New Haven that was so helpful in really introducing the vaccine, it just doesn't, the story doesn't actually ring in the same way. Fourth, it's important to acknowledge where people are coming from, which in some circumstances could include some hesitancy. And, certainly really the goal in all of this is to give people the information that they need to make an informed choice. It is ultimately an individual choice to get the vaccine. And, we just want to make every effort possible to ensure people have the right information to make that decision. Connected with that point, really certainly to provide, where we're able and where we're speaking about some of the facts and the science behind the vaccine, that evidence basis and unbiased answers. Sabrina, if you could advance. This can hopefully be a helpful sort of cheat sheet for individuals as they're thinking about, what is the right way to respond? How can I sort of start to frame up what I would say when asked a question about the vaccine? I won't go through it in great detail, but I think it's quite connected to the points on the previous page, really emphasizing personal experience, key facts about the vaccine, namely that it is free. Even if an individual does not have insurance, you should never receive a bill for this as an individual or as a patient. Thinking about positive experiences that you can share from your own life, your families, your communities, and then being there to answer people's questions, really, serving as a resource and being a place where they can air concerns. I'd be interested in everyone's responses, but in light of time, maybe Sabrina, you can just take us through this next section and then we will open it up for questions and ideas. Thank you.
Thank you. So we really want to focus on enabling access within your community. So I will sort of highlight a little bit on where you can receive the vaccine and different options to accessing it. So a few of the options are scheduling through the Vaccine Administration Management System, also known as VAMS, and that can be used to schedule appointments at multiple clinics across the state. And we will share this slide deck with you after the presentation, so you do have access to these links, as well as the phone numbers. You can also call the Vaccine Appointment Assist line, and that number is here, and they will assist with scheduling at locations across the state. And then they do also have non-English language assistance available. And then you can call 711 if you need hearing assistance. And then additionally, the Hartford Healthcare has multiple locations throughout the state, including large clinics in the Hartford area. So you can use the My Chart to schedule that, and there's a link and phone number as well. A few other options are at the Yale New Haven Hospital, as they have multiple locations throughout the state. And then you can also use My Chart to schedule that. Stanford Health is operating a 7-day per week at the Stanford Hospital. And the link and phone number are there as well. And then areas like Walgreens, CVS, and Walmart are also offering the COVID-19 vaccine. So really just focus on looking on locations across the state. and those links are provided there as well. And then you can just type in your zip code and look for additional locations near you. And then lastly, we want to also focus up on the follow-up on those requiring help with scheduling or transportation. So we have shared a few resources for appointment scheduling, and these are online resources that highlight accessibility practices for vaccine locations, a map of vaccine sites, as well as a scheduling navigator guide and support in using the VAM system. And then local libraries are also, well, some of them are also setting up call centers to help with scheduling appointments. And then for transportation, you can check out the link here to access information about transportation and rides for their transportation resources. So you're able to use the vaccine appointment assist line to schedule their appointment and then notify a representative, and they can also help you with your transportation needs. So this list is growing. If you know of any resources that we should highlight, please feel free to share that with us, and we'll be happy to really disseminate that with the community. And then also, we can also ask how, if there are any other resources that the communities need that you think that the state should work on.
I think Marlo's point in the chat is a really good one, and that is for all of you, you have at least one local federally qualified health center, and they are all getting vaccines directly shipped to them. And so that's another great resource, is to contact your local federally qualified health center.
Awesome. Maybe Sabrina, if we could advance, I think that's a good start to our discussion on slide 24. Yes, FQHCs, I think, Marlo, to your point, and Deb, to your point, they've been hugely instrumental in Connecticut and elsewhere. I think they're behind a lot of the creative efforts to think about how to make the vaccine more accessible and where it needs to be, both within the buildings that the federally qualified health centers are in themselves, as well as more broadly in the communities. Last weekend, I know, for example, in Fairhaven, the Fairhaven Community Health Center started a door-to-door effort in Fairhaven specifically, providing information on the vaccine to individuals living there. And they did that with a few community organizations in that area, Vera Institute of Justice, Unidad Latina Anexion, and others. So I think they're both playing an important role, getting significant supply from the federal government, especially as of late, as Deb mentioned, and then certainly have been real creative engines too in making this better. So, I mean, I think at this point we would love to open it up to discussion and to ideas. I know in the beginning we heard some of your observations on what you are receiving from clients in terms of asks and inquiries. Welcome additional ideas there, but I'm curious, what opportunities do you all see? Marlo, I think, mentioned one with the role of FQHCs, but I'm sure there are more. What opportunities do you see to increase access and awareness of the vaccine in your communities and for the individual clients that you support? Love to hear ideas aloud or in the chat.
Actually, I have a question to kick off this section, and that is for those of you who have childcare centers on site. Do you think that once eligibility is opened up to everybody on April 5th, you might think about hosting a clinic for the parents? So as they're dropping off or picking up their kids, they might be able to get a vaccine on site, if that's something that you could coordinate?
Hi, my name is Denise. I'm the Community Outreach for New Opportunities. And what I found to be successful in providing information to the community during the pandemic is the Farmers to Families food trucks. That people come out for food, and then we have some Amazon giveaways that we do sometimes as well. So, and we also have the daycare, and we contact them. And now we also, on Mondays, we give out milk through the Connecticut Food Bank. So we're a food distribution site as well.
I love that.
So I want to echo Denise's thoughts there, because especially at the food banks, they haven't stopped operating throughout the entire pandemic. And we operate the New Britain Food and Resource Center in New Britain. That's a place where it would be fantastic to, again, host group, what I'm calling group vaccinations. So I put in the chat, we just had 191. That was an in-house HRA staff and people who were currently eligible because they were over the age of 55, right? And I'm working with CHC to schedule 2 others because, again, as the availability opens up, more people within our organization become eligible, and we're trying to, operate safely because we have been open throughout the entire pandemic. So I think one of the things to consider here when sharing information and approaching community partners and trusted messengers is to really have a sense of, what has been their comfort level throughout this entire experience over the past year. Are we talking to people that really stayed shut in over the course of the pandemic, due to fear and anxieties? Then we need to have a stronger message for people who experienced the pandemic in that manner. I feel that people who are linked or associated to organizations that have been on the front lines, such as everybody on this call, may have a different viewpoint on it because we've been on the front lines and we're dying to get vaccinated here and wondering why we weren't included as essential workers as we were in the beginning when we were told to stay open and serve people. So that kind of thing.
I know that's very well taken, Arlo. Really, all of your points are well heard, and I think it's just a tremendous demand right now, and obviously an effort to do everything we can to support people in getting the vaccine at this point. With your idea on the role of food distribution centers and soup kitchens, I'm wondering, in addition to clinics, do you see there being value in sharing information, even leading up to a clinic, and what would that look like to you based on your experience in the pandemic?
Well, I know I have a lot to say about this because it's been on my mind for an entire year. Yeah. So, and I'm like, yes, we're ready to do something now. Thank you. So at our food distribution center during the pandemic, because we made adjustments to distribute, and we're a strong partner with FoodShare. So they made us a hub. So, we're serving like hundreds of families a day when we're open, right? A lot of food moving through there. So we implemented use of an electronic system in order to, keep track of who's coming and all of that, right? So I think that integrating appointment setting at the food pantry would be a great way to encourage, again, because we're seeing so many people and the numbers of people are likely to increase as, other supports begin to fall off. And that's a strategy that can stay in place at the food distribution centers for, as long as it's needed in order to achieve the numbers of people. And then it just so happens that, of course, at least in our area, which we're in New Britain, inner city and very diverse. So, in our community, at the food distribution center, you're actually reaching the populations that are underserved in the process of, integrating there. May not be the same in some other communities that are implementing the same strategy, but there'll still be people experiencing poverty, but they won't necessarily be people of color.
No, that all makes a lot of sense. And it sounds like a really important idea to, I think we would be happy, and hopefully today gives, either in the course of this discussion or in the follow-on materials, we'll share resources that you all can use. But I think we've also seen, when it comes to things like flyers or social media, often the best ideas, the ways of sort of articulating things that resonate most with individual people receiving services come from the people that know them. And so, we're just here to hopefully collaborate and share what we know with you and give you all a head start to the extent that this helps in your programming.
Thank you. Well, this is great stuff. And, as much as you can allow us to share, what we're going to receive, like, for example, the slides that you had that shared the different vaccination sites with nice visuals. Those are great. If we could be allowed to share those on our web pages, on our Facebook pages, post them as posters for the places where we're open, because we're also a childcare provider, and we're ramping up to start back on our 700 families, and then there's just one more thing, and then I'll mute because other people need to say something, but I'm just like dumping out everything I've been holding in. So but how there's the contact tracing that we've been doing, right? When people have, we've been doing it internally, and I know many of the organizations on the call here are doing the same thing, because we had to figure out how to operate safely, during this time period. So we've been doing contact tracing when people have risks in terms of having been exposed. So it's almost like reverse contact tracing for the vaccinations. So, someone comes in, can you connect or register people that are associated with you, like right there, while you have the person there. Oh, by the way, schedule your everybody that in your vicinity.
These are powerful ideas. I mean, I think, and it's exactly the role that you all can uniquely play, I think, depending on what, what the level of sort of people that you have supporting this effort and what your sort of interest is. But I think it really makes such a difference, as you're saying, Marlo, to like explore the connections and ways of expanding access to other people, and then linking information with existing programming. So this is wonderful.
Sure. If they can't literally schedule people, at the very least, treat it like the retail people do, refer 10 people that right here. So it goes to them in their text messaging or in their emails, and then those people will get in. Use the people to get to the people, basically.
Yeah. And I think another idea that we've seen in other parts of the country that could be worth thinking on is, even when people come to get the vaccine, say it's at an FQHC and it's not at the community action agency itself or at the food distribution center, what sort of social supports, what kind of information can you provide to help people who might be new clients there, or people who are existing clients but might need extra help to sort of like reinforce and make them comfortable. So I think it can cut different ways, but I think everything you're pointing out is really powerful and makes a lot of sense. I'd love to hear reactions from others. I know, Ian, you mentioned that it sounds like there are, similar practices in place with your agency, Access. Would you like to talk a little bit about that?
Absolutely. It is a much more efficient way for us to reach. I mean, it's been about getting food into the mouths for us. And in addition to being involved with the food pantries that we have, I'm a community resource coordinator. So I bring resources to people so they can quarantine effectively. And if I didn't work in partnership with all of our other departments, frankly, and Rhiannon and I don't know that I'd be able to effectively do my job. But primarily it's about the food, and scheduling things and doing it all virtually has been the only option, really. And so we needed to build that out quickly. We did it early in the fall, and I think it's just been great. Now, is there a degree of buy-in that still needs to be built within the organization? Absolutely. But it's all a component of our moving over to the Google Suite, and that has really made so many things much easier.
Wonderful.
And I would encourage others to follow a similar model. And then in terms of leveraging the people who are gaining benefit to reach other populations, absolutely. I mean, I don't know that there's a better way to do it. We've even moved to a virtual inventory system where we are tracking on tablets what folks are coming through and collecting, right? So it's really cutting down on food waste. We're not giving people food that they don't plan on using. And that way we have more resources to distribute to other folks. I can't say enough about it. And so if folks want to talk about that and discuss it further, I'd be happy to walk you through soup to nuts. And yes, that's a food pantry pun.
Wonderful. Thank you, Ian.
I don't know if it was mentioned because I was disconnected for a second, but also reaching out to the faith-based organization. They trust their pastor, the priest. So if you can buy them into it, then they can share the information to those that go to their congregation. That's a good way to go about getting the information out to the community.
I think that's wonderful, Denise. And I mean, I think we'd love to hear sort of and help think through your next steps. I know people will take this information in today and probably take some time to reflect and think about what's possible. But we have had one Trusted Messenger forum with faith-based leaders. I know that there are a number of groups active in the state, others that want to be active. And so to the extent, I think, Denise, to your point, that you could think about local churches and houses of worship that you could connect with, I think that could be really wonderful.
Question for the group. When people come in, or I guess use the phone now for VITA, the income tax assistance, is that another opportunity for you to talk with them about vaccine availability? And I guess my actual question is, now that the income tax deadline has been extended through mid-May, will you extend VITA as well? And if so, that gives it one more month worth of opportunity to speak with folks about vaccines.
Well, we operate VITA year round, so that's a yes for HRA in Central Connecticut. We serve about 6,000, but this year we're only up to 4,000.
That's awesome.
We have VITA as well as New Opportunities. We don't serve 6,000 though. That's the high number right there. But I guess we can mention that during pickup. If we have information or literature to pass out, we can pass it to them when they come pick up their taxes, because we're doing a no contact. So we can also provide them with that information if we have literature on it.
Definitely. And we'll be sending you some materials today that will be useful. And I think depending on, when you look at those materials, certainly feel free and let us know if you think you need something different to reach your population. There are organizations that have created related materials across the state, and there might be opportunity for us to think about tweaking something that works for you, or frankly, also, as I mentioned, welcome your adapting the information that we share to make it resonate with the individuals that you serve as you see fit. What about other ideas? Or I know Deb also mentioned, and I know this had a really significant effort over a long period of time. But like with the census, I know there were some creative ideas, it sounded like, in terms of outreach. I'd love to hear reflections on what might be possible down the road, knowing obviously that, certainly funding would need to be there.
I was thinking area soup kitchens too. I sit on a board of directors for Northeast Connecticut soup kitchens, and our numbers have gone up exponentially because of the pandemic. Like, they're seeing almost twice the numbers they were before, sometimes as much as 3 times. One of those mobile sites would be ideal if they could get a van to places like that and do vaccines there. That would be, and I know the staff is all on board, and a lot of them are volunteers who also use the soup kitchens. So
that's great. I think that definitely would be really wonderful to make happen. And I know that there is, in the coming months, I don't know if we can say weeks yet, I do think that there's going to be an emphasis on how do you make vaccinations more mobile and more accessible in different places. I know certainly in different cities, they're already doing that to, a bit of an extent, but I think certainly that will increase in importance, and hopefully there will also be the, transportation, the personnel, and the supply to support it.
And for those of you who have Meals on Wheels, I know that's something that I've sort of been tossing around this idea with some folks at DPH about being able to utilize Meals on Wheels vans to, you give somebody a meal and you have a nurse on the van who gives that person a shot as well. So that would be beneficial for homebound individuals for sure. And then maybe, I don't remember who said it. Oh, Marlo, I think it was you. Whoever else is in the household, right? So the meal is for the person, and then maybe there's, you know, 1 or 2 other people living there. Maybe they can get the shot too.
And I know there were some questions around homebound very early in the conversation, and I don't think that we addressed them yet in terms of just information on what's happening. And so I think what, you know, Deb and Marlo are raising, that's definitely, you know, a set of ways that homebound vaccination could be expanded, and I think would be really helpful to people. To this point, you know, it has been, I would say for weeks, it was a bit of a question because there were concerns around how exactly do you transport the vaccines? Is it allowed? Can they be stable? Because as we talked about, they don't have the preservatives that a lot of other vaccines have. There is concern about like shaking them up too much, and certainly refrigeration. So happily, we've moved beyond that point. And so now we know that homebound vaccinations can occur, but the way that it's being handled is it's still at this point quite municipality based. And so in many cases, it's local health who's leading the charge, or at least identifying who are the additional providers, whether they might be EMTs or like VNAs that are supporting in their municipality. And then the state, in tandem with that, is thinking about, if you look at every town's existing planning and availability of people to deliver homebound vaccinations, where are their gaps? And so the state and local health are really working together. But I would say that is one area where, you know, thankfully it seems like the technical solution's in place now, but certainly the coordination and making that happen for people at the numbers that will require it is still a work in progress. And I think Meals on Wheels could be a really wonderful thing to get connected into, perhaps where it makes sense.
I know we've talked a lot about access to the vaccine, and earlier there was a question about engaging groups who are apprehensive and distrustful regarding getting the vaccine. Are there any specific apprehensions that you may have heard from the community that you feel like you need specific tips and tools on engaging the groups that we could offer?
I recently received some information that they do not require ID nor insurance to receive the vaccination. So I think that especially for the undocumented population, that'd be good to get it out there to let them know that they don't have to show ID or have insurance to get vaccinated.
Yes.
Because you might get apprehensive. You might get a lot of that population not wanting to get vaccinated because they don't have ID.
Yeah, and that can be very stressful when, you know, having to be requested for your ID. So just knowing that that's not something that they have to experience, I think is super reassuring.
I actually did not know that. And I have my vaccine scheduled for, my first shot scheduled for tomorrow. And I'm pretty sure I do need to bring out an ID so that they can verify that I'm in one of the eligible categories.
So the way that it works is that a provider will, in many cases, ask an individual for their identification. But if they say, I don't have it, then they cannot be denied the vaccine, and they shouldn't be asked for it, you know, in any way that prevents them from receiving it. The reason a provider asks for it at all is, Deb, to your point, like, I think certainly because this has been age-based, people are looking at birthdays, they're checking like the name matches the appointment. But it's super important for you all to share with individuals who might be concerned that they can just say they don't have it. And that can be true whether they truly don't have a driver's license or a passport, or if they just forgot it in their car and they don't want to go back. You know, they're not going to, the intention is you should get the vaccine if you're at your appointment. You should not be denied it. And then I think the, you know, the second piece around insurance and just comforting people that they won't receive a bill individually for the vaccine is also important. So I think, you know, it's certainly coming up to our time. And Deb, I don't know if you had any sort of closing questions or next steps that you wanted to ask of the group.
I will just indicate next steps, which are, I think, are Megan and Sabrina, are you all going to send information to me and I'll ship it out to everybody who's on the call today? Is that the plan?
That's exactly right. And there will also be a survey with it on today that we would really appreciate your filling out. It doesn't take very long.
Super. And then let's all just stay in touch, because as we know, if there were funding available for this, that would allow you to boost your efforts around outreach and education. And as your state association, we are still in communication with a variety of different people around the possibility of funding. We haven't made any headway yet, but I just want you to know that that is something that we're hoping to obtain so that you can boost your efforts around outreach and education. I recognize you have a lot of different priorities. So we'll just stay in touch, and I'll have the information out to you, and please do complete the survey for Megan and Sabrina so they can get some feedback around future sessions.
And please do feel free to use any and all of the materials that we share with you. And so, you know, whether it's the slides on scheduling options, you'll see different ways that you could print and share materials, our slides just being one of them, but, you know, please don't hesitate to use those as you see fit. And know that we'll be providing you with more information in the weeks to come as more becomes available, because certainly the Department of Public Health is working hard to continue to make better resources there, and, you know, information's changing. So look for us to stay in touch, and please don't hesitate to reach out with questions.
Thank you so much. And thank you to all of you for giving of your time this afternoon to attend this session. I think it's always great to get everyone together. And I know you all are working really hard on so many different issues right now. This is really important. I'm glad that we were all able to learn from Megan and Sabrina and Dr. Mehta and from each other as well.
Thank you so much, Deb, and thanks to everyone.
Thanks, everybody. Have a great afternoon.
Everyone.
Thank you. Bye.
Bye.